Thank you very much, Mr. Chair. Long before I came to the Senate, I was fighting for my state to expand Medicaid, which would give an estimated 600,000 Georgians access to affordable health care. But here we are, 15 years almost to the day of the Affordable Care Act being signed into law, and still Georgia has not expanded Medicaid. Georgia continues to deny its citizens access to this program that's being supported by the tax-paying Georgians. To make matters worse, now Washington Republicans have proposed to gut almost $900 billion from Medicaid to give millionaires and billionaires an additional tax cut, potentially kicking millions of Americans off of their health care insurance. Medicaid covers almost 40 million children across the country, 2 in 5 children in Georgia, 1 in 10 veterans, 63% of seniors in nursing homes. Medicaid also supports 1/5 of all hospital spending, especially in communities without many hospital options. Washington Republicans and Dr. Oz say they want to make Medicaid more efficient by requiring people who get their health insurance through Medicaid to fill out government paperwork each month to prove that they are working. Here are the facts. Here are the facts. Nearly all adults enrolled in Medicaid are either working, in school, or caregivers. By and large, if they can work, they do work. I know that may be hard to believe in a country that increasingly maligns poor people for being poor, but by and large, these folks are already working, or they're caregivers, or they're students. They are construction workers, they are restaurant servers and mechanics. They're doing exactly what Dr. Oz and Washington Republicans want them to do. But here's the deal, Republicans need a whole lot of money to pay for their tax cuts for the wealthiest among us. And they know if you give people enough bureaucratic hoops to jump through, then enough working people will get tripped up by the red tape and lose their health care. And so that's the plan. Less money spent on a working mom's cancer treatment because she didn't fill out the right form every month by the right deadline, so you have more money for billionaire tax cuts. We know this because I live in Georgia. Georgia is the only state with work reporting requirements in its Medicaid program, and all of this program has to show for itself 5 years later is 6,500 people enrolled. We've got nearly 600,000 Georgians who are in the Medicaid gap. The governor's program has enrolled a whopping 6,500 people. Mr. Chair, I know I'm running out of time, but as I close, and nobody believes a Baptist preacher when he says as I close, let me be really clear that I'm voting against Dr. Oz. I think he is knowledgeable, certainly more knowledgeable than Secretary Kennedy about the program that he's tasked to lead. But we've got to take seriously the needs of millions of Americans who will lose their health care. And so I'm voting no for his nomination, and I urge my colleagues to do the same.